Every 10 seconds, a person will die from alcohol-related diseases.
The World Health Organization estimates that 3.3 million people die every year from alcohol-related conditions.
Alcohol is the fifth leading contributor to the global burden of disease.
The harmful use of alcohol is linked over 200 diseases.
Globally, in the 20 to 39 year age group, alcohol consumption is attributable to 13.5% of deaths.
Despite these facts, alcohol products are prolifically advertised through sports, on the jersey of your child's favourite athlete, on billboards advertising the next sporting event. Alcohol and sports are inextricably linked. My name is Alexandra and these are my colleagues Rebecca and Diana. Through this presentation we intend to report the epidemiology of alcohol use and harm, explain the numerous and surprising links between alcohol and sports, and finally implore the World Health Assembly to act on the global health issue that is alcohol advertising in sports.
Latest World Health Organization figures on alcohol consumption demonstrate significant global intake of alcohol and disparity across regions. The global average of alcohol per capita for 15 years of age and over is 6.4 litres of pure alcohol per year. European nations lead with 9.8 litres. The Republic of Moldova tops the global average at 15.2 litres. The Americas are second at 8 litres. Western Pacific nations are third at 7.3 litres, Africa is at 6.3 litres, and Southeast Asia region 4.5 litres. Finally, the lowest consumption pattern is seen in the Eastern Mediterranean region at only 0.6 litres. Alcohol has a broad global history. For millennia, alcohol had been prescribed for the therapeutic treatment of physical ailments as well as poor mental disposition. Since the early 20th century, however, alcohol consumption has been clearly linked to the burden of non-communicable diseases and to the negative impact of social vulnerabilities. Harmful use of alcohol is correlated to the pattern of its consumption. Increased volume and frequency of drinking is linked to increased health risks, demands on health resources, and pressures on community populations. For example, prenatal harm and premature births, liver cirrhosis and cancers, accidental injuries, falls, drowning, burns, and other acts of stupidity, intentional injuries, violence to self and others, unemployment, and the impact on children. In terms of global financial costs, alcohol-linked diseases, injury, and violence have been estimated to cost related sectors $125 billion per year. Further intangible costs of pain and suffering are estimated to increase this by hundreds of billions more. In an effort to reduce alcohol-related harms, multiple international frameworks have been created with the increasingly available national and international alcohol consumption data.
Alcohol is one of the most heavily promoted products in the world. Alcohol advertising contributes to the normalization of alcohol use and refers to the harmful drinking culture that currently exists worldwide. Alcohol marketing through sports is visible to children and young people, as sporting events are often held or televised during times when they are likely to be watching or in attendance. For example, New Zealand is a small nation with a small market, and this limits the number of sport sponsorship sources. This has resulted in well-financed alcohol brands funding sports teams and events. The adverse effects of these trends can be seen in high alcohol intake levels and negative health statistics. Comparably, in Australia, alcohol is the major contributor to the three leading causes of death among adolescents: unintentional injuries, homicide, and suicide. This has been recognized as a nationwide crisis, and currently action has been taken to ban alcohol advertising in sports. Many countries have already successfully removed alcohol sponsorship from sports, including France, Qatar, Norway, Denmark, Croatia, Russia, and others. In the case of Colombia, South America, in 25 years, the laws that regulate the advertising of alcohol and tobacco in soccer stadiums have been modified several times, creating controversy and concerns over the sports financing. In 2005, the response was to ban alcohol advertising in sports. On the other hand, The tobacco industry spends tens of millions of dollars worldwide each year on advertising, promotion, and sponsorship. A successful campaign to restrict advertising by a large multinational is clearly seen in the Framework Convention on Tobacco Control. This campaign by the World Health Organization sought to end the tobacco industry's pervasive contributions and control over various sectors of society, including sports. Plain packaging and other advertising restrictions, as well as taxation, have reduced demand for tobacco in nations that adopt FCTC recommendations. This campaign could be used as a valuable model for the regulation of alcohol advertising, particularly in sports, globally.
For these reasons, we propose that the World Health Assembly move to adopt an amendment to Target 3.5 of the Sustainable Development Goals, in an effort to explicitly identify alcohol advertising in sports as a global health issue. Alcohol advertising in sports is not currently acknowledged as a factor leading to the present proliferation of non-communicable diseases. However, considering the previously discussed impacts on health and well-being of communities globally, it is imperative that a move is made to adopt alcohol advertising in sports into the WHO Agenda 2020. This is in line with Sustainable Development Goal 3 for good health and well-being. We move to include Indicator 3.5.3, which is intended to promote national regulations that restrict alcohol advertising in sports and monitor alcohol advertising in public media. Movement towards and achievement of this resolution requires a number of important milestones to be reached. Firstly, the WHO must formally recognise the lack of regulation in alcohol advertising, particularly in sports, as a global health issue. Secondly, member states must facilitate research into the burden of alcohol-related issues alongside the prevalence of alcohol advertising in sports. Finally, each individual state should work to develop policies and regulations to track and legislate alcohol advertising in sports. By encouraging each participatory nation to adopt strategies that regulate alcohol distribution, restrict advertising, and increase alcohol prices, alcohol-related non-communicable diseases and addiction disorders can be reduced. These interventions and their consequences may be viewed as feedback loops. Each government policy enacted to restrict alcohol advertising in sports has flow-on effects to business, eventually affecting the supply and demand of alcohol and having widespread effects on health and ecology. One example of a policy implemented at a government level going on to impact other areas is through tax. If an additional tax was placed on alcoholic products, this money could be used to buy out alcohol company sponsorship of sports teams. This use of tax-derived money has the potential to reduce population exposure to alcohol advertising, reducing the demand for these products. Additional tax-derived money could be invested into programs that combat alcohol-related health issues, for example, through detox programs and funding for support groups. By using governance through careful policy implementation, global citizens are enabled to make healthy and sustainable choices.
To the World Health Organization Executive Board, we implore that this amendment is included in the 2020 World Health Assembly. It is vital that this health issue is addressed through our proposed indicator 3.5.3, in addition to the Sustainable Development Goal 3.5, which aims to improve the health and well-being of all people. We believe that this resolution will assist in the achievement of the reduction of harmful use of alcohol by 10% by 2030, adding to the lack of defined reduction target in SDG 3.5.